Hello friends, good evening. So we are going to see tonsil part 3. So these are different lookalikes which you see in the Google. So why am I discussing this? So a white patch or ulcer on a tonsil is like a lookalike. You will be given multiple scenarios in your NEET PG, INICET PG and FMGE. You will be asked to identify what are the different types. So now I am going to make you go through different scenarios of tonsillar white lesions, white patch over the tonsil. So before going into topic, can you identify this picture with a membrane over the tonsil? So what is this type? This type is known as acute membranous type. Agreed? We discussed in the previous session that acute membranous is nothing but a coalescence of all the pus points on the surface of acute follicular to form a acute membranous tonsillitis. So this membrane will not be same as your diphtheric membrane. Then scenario 1 is acute membranous tonsillitis. Now coming to scenario 2, which is diphtheria. So now how will you identify a diphtheria? So in a exam, the scenario would be given for a diphtheria would be there is a pseudo membrane like this. So why it is called pseudo membrane, sir? So because if you try to remove acute membranous tonsillitis membrane with a forceps, it will be easily removed. But here it is adherent. It is adherent. So it is adherent to underlying tissues of tonsil. So once you remove this, there will be what? Bleeding. So in this second scenario, if you note down, they have given one neck node picture. So this picture of neck node enlargement is known as bull neck lymphadenopathy. So the first picture, pseudomembrane. Second picture, bull neck lymphadenopathy. It is due to diphtheria. Diphtheria is caused by Corynebacterium diphtheriae. The membrane is pseudomembrane. Again, here also exudates form. But this membrane is not limited to tonsil. Like your acute type, it extends onto soft palate. You can see here it is soft palate free, only limited to tonsils. Here it is extending onto uvula, soft palate everywhere. So one more difference between acute membranes and diphtheria is acute membranes is confined, diphtheria is extensive. Overall, the child will be toxic. The child would be toxic. So a toxic child, unimmunized child with pseudomembrane, the membrane which bleeds on removal, along with bull neck lymphadenopathy, adherent membrane caused by Corynebacterium diphtheriae, and Albert stain is used to identify the bacteria. Treatment is penicillin. So this is in just about diphtheria. Now coming to one more scenario, sir, here also some exudates are there. It is acute condition, yes, because redness is there. Along with that, there is neck nodes. Along with that, there is hepatomegaly. And if spleen is there, splenomegaly is also there. Hepatosplenomegaly. So this is due to what? This is due to Epstein-Barr virus. And the condition is known as infectious mononucleosis. It's a viral disorder caused by Epstein-Barr virus. You will have tonsillar exudate like this. Membrane will be formed, and this membrane surprisingly is due to Epstein-Barr virus. Epstein-Barr virus, and you have posterior back neck lymph nodes, posterior lymph nodes, and hepatosplenomegaly. So if they give this scenario along with that, they will give one more condition known as atypical lymphocytosis is seen on complete blood picture. How much percent? More than 10%. Along with that, you will diagnose this condition with Paul Bunnell test or IgM antibodies to EB. Treatment is supportive. Sir, I want to give penicillin thinking that it to be a streptococcal infection like acute membranous. Ampicillin, if you give in this condition, it will lead to rash. So ampicillin should not be given, it will lead to rash. So this condition is known as infectious mononucleosis, and the caused by Epstein-Barr virus. Treatment is supportive because it's a viral condition. Next, third condition here, you can see tonsillar exudates. You can see tonsillar exudates, and you see the tongue picture. This is known as strawberry tongue. Now you tell me, there is swollen dusky red tonsils and tonsillar pillars. There is swollen dusky red tonsils and tonsillar pillars. You can see dusky red tonsils and tonsillar pillars with the strawberry tongue. This condition is known as scarlet fever, caused by streptococcus again. So here also there will be tonsillar white patch or yellow patch or exudates or ulcers, but there will be strawberry tongue. So condition 3, scarlet fever. Condition 1, acute membranous and diphtheria. Condition 2, infectious mononucleosis. Condition 3, you have scarlet fever. Now coming to this condition, you can see multiple white patches at different locations on the tonsil and soft palate. This patient is immunocompromised. Now tell me, what is this white patch over the tonsil is due to? So implied that immunocompromised patient, it is known as fungal pharyngotonsillitis or candidal pharyngotonsillitis. So this is candidal infection. Next common fungal infection would be aspergillus, but the most common is candida, immunocompromised. Next interesting type of tonsillar exudate, it is unilateral. It is unilateral tonsillar exudate, but it is foul smelling. It is foul smelling. Along with that, they have given gingival ulcers. You can see gingival ulcers at the multiple points. You can see multiple ulcers at multiple points. So these are known as Vincent. This condition is known as Vincent's angina. And the other name for this condition is trench mouth. Why it is trench mouth? It is called trench mouth because it is acute necrotizing ulcerative gingivitis along with tonsillitis. Acute necrotizing ulcerative gingivitis. On the gingiva, there will be multiple ulcers. Along with that, there will be necrosis. So damage to gingiva will be there like this at multiple points. It will lead to foul smell. Along with that, you see unilateral tonsillar exudate ulcer like this. So this is the classical phenomena you should understand about Vincent's angina. Vincent's angina is caused by Borrelia vincenti. It is also known as trench mouth or acute necrotizing ulcerative gingivitis. It is seen again in little bit of immunocompromised. Here also there is a pseudomembrane. So whenever pseudomembrane was told, you don't think about diphtheria. Here also there is pseudomembrane because of exudates. But here you can remove it easily. It is also pseudomembrane, not a true membrane, but here also you can remove it easily. The classical question that can be asked is French mouth or Vincent's angina is caused by your Borrelia vincenti or a spirochete, fusospirochete. The other name for this is ANUG, acute necrotizing ulcerative gingivitis. Now coming to another 3 important slides which can give the picture of white patch. So here you have multiple studded dots which are whitish in color. Actually, they are not pus points, they are white. They are white. So this condition is known as tonsillar keratosis. This condition is known as tonsillar keratosis. So what is the treatment for this condition? There is no need of any treatment. It is just a tonsillar keratin deposit, keratin accumulation, and you cannot wipe out this keratin. You cannot wipe out this keratin. It will fall on its own. No treatment is there for this condition. Next scenario, you can see a whitish thing on unilateral surface. This patient is a chronic tonsillitis patient, but later he developed this condition. What is this condition? There is a stone within the tonsil. This is known as tonsillolith. So what is the treatment for this condition? Tonsillectomy. What is the treatment for this condition? Tonsillectomy. So tonsillolith is nothing but in a chronic tonsillitis patient, recurrent tonsillitis will provoke calcium deposition on the surface leading to stone formation. That is known as tonsillar stone or tonsillolith. Treatment is tonsillectomy. Now coming to next condition. This condition is known as tonsillar cyst. There is smooth swelling involving the tonsil, unilateral side. This is smooth swelling involving the unilateral tonsil. So this condition was tonsillar cyst. You can do tonsillectomy in that, or removal of cyst is also okay. So that is about different white patches over the tonsil. Note down the points easily. You can understand better. Thank you.